With the muscle activation techniques, we use range of motion as our guide. And that we're going to look for restrictions in range of motion, because tightness or the right restriction shows us where the body is protecting, and those are the muscles or the area that we would need to address. So we usually compare how one side moves next to the other. The only problem with that sometimes is both sides can be off, but typically a person has one shoulder or one hip or one side of the body functions perfectly and the other side has some limitations in it, and often it's the dominant arm, but not always. So we would go and compare to see how far does this arm turn backwards compared to this one, and anytime we see a discrepancy in range of motion, we would address the muscles that are responsible for taking you into that motion. So, and essentially, and if I have this rubber band here, essentially any rubber band on the front of the body is going to pull the arm forward, and any muscle rubber band on the back of the body is going to pull the arm, and how hard that is to see, it's going to pull the arm backwards. And if you study the shoulder enough and all the different angles that these muscle fibers are going, you can figure out then, well, here's 5 muscles that turn the arm this way, or lift the arm this way, or pull it this way, and those are the muscles that we would address first, the muscles that have to do with where your limitation in motion is.